launching of the Nadi anti-dengue campaign program. Dear audience, I would like to challenge the folk department, the Tuinawaka, the village headman, the advisory councillors. This can take place throughout the country, not only in Nadi and Ba generally.
Work together, as you have said. Cleanliness, personal hygiene is most important.
We have our Honorable Assistant Minister for Health, Mr. Alex O'Connor, who has always been coming to all our
District Officer Nadi, heads of government departments, Assistant Roko Tuiba, Thrangani Koros, our Chief Health Inspector Mr. Deep Chand, Divisional Medical Officer West, our advisory councillors, NGO partners, invited business communities, school children, teachers of invited schools, any other invited guests or media partners. Ladies and gentlemen, Isambula Vinaka, and a very, very good morning to you all. Indeed, it's a pleasure to be here this morning in my hometown to launch this. Please don't mind, you might think I favored Nadi because it's my hometown. No. Well, I don't know why, Deep, you chose Nadi, but I might have a conflict of interest here. I hail from Nadi, okay? And like I said, it's indeed a pleasure to come back and give back to the community things in order to promote healthy living. And especially this morning, we are talking about dengue. Actually, 2 days ago, I was talking to some people when we launched the World Mosquito Program, and I said, these mosquitoes have taken my sleep away for the last couple of months. I haven't been sleeping, not because they've been biting me, but because they've been biting our people, and we're trying to find a solution to that. So indeed, these mosquitoes have taken a lot of our time and energy and our thoughts, and today we are here to see how best we can fight these mosquitoes. And I'm sure with the presence of so many school children and educators, your teachers here, we are definitely going to find ways by which we can stop the spread of dengue. And thus we are here launching the Fight the Bite campaign, a cleanup campaign to assist in controlling the current outbreak of dengue fever in Fiji. Our Talatala spoke about cleanliness is next to godliness. I don't know where along the way we've forgotten to keep our environments clean. Why have we suddenly become so careless over the years in terms of rubbish disposals, in terms of destroying the breeding grounds of dengue-causing mosquitoes? Well, nevertheless, it's not too late. So we are here together with all our partners to see how best we can pave the way forward and reduce the number of dengue cases and actually wipe out dengue cases amongst us. And it is something that you and I can do. Many a times we as a government are said, oh, government is not doing much, the ministry is not doing much. But ladies and gentlemen and dear children, there are a lot of things that we cannot do on our own. My team cannot do it on our own. The government cannot do it on our own. We need your support. And your presence here this morning indeed is a clear indication that you are all part of this very, very important campaign. Let's clean up Fiji and let's fight the bite. Okay? So, according to the latest Ministry of Health statistics, we have close to 1,854 people currently with confirmed cases of dengue. That's quite a high number for this year. Okay? And when compared to the number of cases for the same period last year, the rate now has doubled. So you and I both can imagine the work that we need to do to ensure that in the coming months we are able to get these numbers down. Ladies and gentlemen, this cleanup campaign started last year, if I may say. It's not something that we've just started now. This is an ongoing process. Awareness continues. We keep telling people to clean their backyards, they clean their communities, clean their towns and cities. So together with the local town councils, the Ministry of Health is always working to ensure that we spread spread awareness about how we can combat dengue. We will not be coming down to your homes. Okay? We will be down to your communities so that you can go and clean up your homes. Please do not expect our officers to come down to individual homes to clean up. That becomes your responsibility. That's why we are here, so that you can take this message back home to your parents, to the parents who are here, to the teachers who are here. You have a very, very important role. And of course, the children, you can be those voices in your own homes. The message, the teachings that you learn in schools, please take it back home to your parents. Please be the change. There's nothing stopping you from cleaning your own homes and backyard gardens. The fact, ladies and gentlemen, one of the most important things that you need to know is that there is no specific cure or treatment for severe, I'm saying severe dengue, as there are no vaccines exist to protect us against dengue fever. But we all know how best we can cure ourselves is make sure the mosquitoes don't bite us. I was surprised to learn that there are close to 26 mosquitoes currently sort of living in Fiji with us. So we have 26 types of mosquitoes. And out of that, only 2. Yeah, Dip? Yeah? Aedes aegypti and Aedes albopictus. There are 2 mosquitoes that cause dengue. But how will we identify them? Right? We can't just say we are going to clear the drains and waterlogged places, the gutters and everything, and avoid the dengue breeding mosquito. We have to wipe out all the mosquitoes. A lot of people say, why don't you spray? Why don't you just spray out the whole areas? Yes, we are doing that. We are doing that in areas where dengue-causing mosquitoes have been found, but I'm sure your teachers are going to teach you that in the environment there are many, many harmless insects, and we don't want to kill them. Okay, so that's why we are not carrying out a mass spraying. But those areas where we have found that people had affected with dengue, causing dengue, we are spraying those areas, and this campaign will continue with that. So, ladies and gentlemen, like I said, dengue fever, dengue mosquitoes cannot be fought alone. You cannot fight it alone. I cannot fight it alone. The government cannot fight it alone. So we are asking for all our partners to come on board and ensure that rubbish and pollution is clearly controlled, because that is a growing problem. People throwing rubbish here and there. Even your own backyards have a lot of rubbish that needs disposal. Burying. In the past, we used to bury tins and bottles and cans. What do you do now? Take the hand out of the window and throw after drinking a bottle of Coke. We have tins. A lot of food that we eat now comes in cans and tins. So what do? We put it in a plastic, we put it by the roadside for the dogs to scavenge, or we throw it out of the window, the kitchen window, into the environment. We need to go back and see how best we can manage our rubbish within our homes. Okay, compost, simple things like compost. I don't know whether schools are doing that or not. Okay, to bury household rubbish. Tins, cans, tires. Tires need to be kept dry. Tins, bottles, and can needs to be buried. Those are the things we need to go back. Burning, no longer allowed, right? We don't promote burning because burning leads to air pollution of the air. So these are the simple things we want schools, teachers to promote within their children. So the whole idea, ladies and gentlemen, coming together is to take more responsibility, be more responsive to the needs of our over-polluted environment. Okay, and so what I'd like to do is ask you all to be responsible, take particular responsibility in making sure that not only your environment is clean, but you are also protected from mosquito bites. Look at posters around this place. I'm sure that's a good learning material for you. You have done those posters, so obviously you have learned a lot from them. Spread that learning to your community, to your parents and other students. So again, a very simple message. Please take charge of your health. Take charge of your own surroundings. Take charge of your homes. And take charge of your life. Make sure you keep your grass cut to a minimum level. Your drains and gutters are clear of water. Don't let any water accumulate around your surroundings. To the community leaders present here, I'm sure this would not be the one and the only time you're having a cleanup campaign. Please encourage your community to have regular cleanup campaigns. Should you need any assistance, please do contact us. Sometimes we have drums. During rainy seasons, we have drums under the gutters where we accumulate water. Cover that up. That's a very, very good place for mosquito larvae to breed. So all in all, let us all be guardians of our environment, okay? And our team, I've been told that our team has been spraying affected areas. Your community programs like yours, there's a big one in Lambasa tomorrow. We have also started to enforce the law, and so far 4 people have been prosecuted for disposing rubbish illegally. We are also targeting areas, like I said, that have been identified as mosquito-borne disease hotspots. But again, ladies and gentlemen, we ask you all to join, not only in cleaning Fiji, but not only in cleaning Nadi, especially in the Waka area, but also to clean Fiji. Nadi, you are aware, is a tourist town. I'm sure we don't want our visitors to come and see how we dispose our rubbish. So it's more important that we keep these areas clean. So, yeah, be part of this Fight the Bite campaign, and I'm sure we'll be able to tackle dengue in the coming months and in the coming years. Take the messages back home. Again, a plea to the teachers, please include this in your daily lessons. Maybe a couple of minutes devoted to healthy lifestyles would also be very helpful. Simple things like hand washing. We encourage hand washing. Okay, we found out that a lot of diseases are caused when people don't practice hygiene. So hand wash is something that you must practice all the time. And you know when to wash your hands. Okay, when coming in contact with a sick person, when coming in contact with animals. Okay, after visiting your washroom, when touching food, when preparing food, when eating food. All these are very simple things. It might sound funny, but these are the reasons why a lot of people get sick. And we need to protect not only our children, but all of you from these diseases. Ladies and gentlemen, another concern for us at the Ministry of Health and obviously at the government level is the outbreak that we declared a couple of days ago. And this is to do with meningococcal outbreak. People commonly know it as meningitis. This is a bacteria that infects your blood, and eventually, if it brain linings, right? Brain linings. If it reaches there, then it's very deadly. So we've declared an outbreak on that as well. And one of the things that I would like you to be mindful of is to know what is the signs and symptoms of this meningococcal. So children and adults, sudden fever. Okay, if you suddenly get fever, that's a sign of meningococcal. Sudden vomiting, headache, stiff neck, backache. Other symptoms, if you have nausea, your eyes become too sensitive to light, and you start having rash on your body. Initially, the rash will start and then become red and purple spots on your skin. This is again very deadly. Actually, this is more dangerous than dengue. And that's why we want you to be on alert for this, okay? We can only treat this at health facilities with antibiotic medicine. So should you have signs and symptoms, either it's of dengue or meningococcal, you need to visit your doctor. Whether it's a health center, whether it's a hospital or your own private GP, please visit them. I would like to repeat the signs again. For older children and adults, sudden fever, vomiting, headache, stiff neck, backache, other symptoms like nausea, your eyes become too sensitive to light, and you start developing rashes in your body. Keep a watch out for those. And like I said, it can be treated if detected early. It can be treated if detected early. Our hospitals and our staff are prepared to assist you. You might hear people saying, oh, we don't have the medicine to treat them. We have the medicine, we have the antibiotics available in Fiji to treat you should you come early to us, if it is detected early. If it comes at a later stage, then let me say it's life-threatening. Okay? And if something is life-threatening, we'd like you to be serious about it. So there's so many of us. If you can just go back home and tell your parents about this, okay? That will also make a difference. And so how do you prevent this? How do you prevent this? That's again very important. People who have cough, people who sneeze, you need to cover your faces. You need to cover your mouth when you sneeze. This disease is not caught by touching each other. This is through saliva exchange. I was in KRC the other day. I was telling the villagers, do not kiss each other. That's funny, huh? It's saliva exchange. You know what saliva is, eh? When you spit, if you have that bacteria, you pass it on to the others. Deep kissing is another way. I know it's very funny, okay? But if you are sick, especially if you have a sore throat, if you have a cough, if you have a fever, please refrain from this, okay? And always cover your mouth, whether you are in the home or you are out in the public. because you are going to help the spread of this. For the adults, it's found that when you exchange water bottles, when you share bilo, especially for those who drink yangona with one bilo, taki, and then you pass it on to the other one, then you pass it on to the other one, that's an exchange there. We are telling people to be very, very vigilant about these things. Don't share your water bottles, children. If you are sick, do not eat from the same plate. Be mindful of where you spit, especially in the home when you have little babies who crawl. They might put their hand on something that has been, somebody must have spat on the floor or something like that. And a toy is lying there. They'll pick it up and put it in their mouth. That's the way. And babies get very, very sick. Children under 5, right, are at a higher risk than adults. So these are some of the things that we want you to be mindful of. And coming back to dengue, ladies and gentlemen, dengue can be fought. Lives can be saved. Dengue mosquitoes can be eliminated. And that's why you and I are here, and the health team is all across the country to ensure that you take these messages very, very seriously. This is no laughing matter, especially to the adults. This is no laughing matter. We want to save lives. We want to save our children and adults from getting both these diseases, dengue on one side and meningococcal on the other side. This one is more dangerous, okay? Therefore, we need a collaborative and a coordinated effort. Look after your health. Drink lots of water. Stay in a very clean environment. Like I said, hand wash. That's the most important things, okay? And I'm sure together you and I will be able to make a difference in our communities and in the nation as a whole. So ladies and gentlemen, with these words, I thank you all for being here. Thank you to the school management and the head teachers for allowing us to be here. The health team, thank you very much for your effort in ensuring that we create a healthy environment for our people. Children, I know it's getting very hot. Ready to clap? I'm ready to sit, okay? I know you can only listen for 10 minutes. But anyways, to all the schools who are here, thank you very much. To the teachers who have accompanied you here, your principals and head teachers for allowing you to be here. But please go back with the message that dengue can be fought, right? Meningococcal outbreak that is currently can be controlled. And we need everybody to be part of that. But all in all, take responsibility for your health, take responsibility for your environment, and take responsibility for your lives. With these words, thank you very much, ladies and gentlemen, and enjoy the day.